Hello, my name is Mark Wilcox. I am the Group Medical Director for Fertility, and I just wish to do a short video on general advice regarding fertility in this current pandemic. These are very confusing and sometimes frightening times, and whilst the medical and social effects of this virus are fairly obvious, there are hidden implications. One of these is on the effect that it is having on fertility. We know that 1 in 6 couples have issues conceiving, and this can have profound effects on mental health. And that's without the effects of the pandemic and the lockdown. This short video then just highlights some of the issues, provides some information, and hopefully gives you some reassurance. Firstly, there is no evidence that pregnancy affects the COVID disease were you to get it. And there's no evidence of harm to the pregnancy from the virus, although in the latter stages of pregnancy there may be some issues. However, hopefully by the time this would come, the pandemic would be long past. So when things don't happen as quickly as you wish, the first step is to go to the internet. And it's difficult there to sort out the good advice from the bad. Some good advice addresses general lifestyle measures, such as not smoking, reducing alcohol intake below the recommended limit, and having a good healthy diet. And not forgetting, of course, to have regular intercourse at least twice a week throughout the month. Women are advised to take folic acid in order to reduce the risk of neural tube defects in the fetus. But beyond these measures, anything in addition has diminishing returns. Perhaps ignoring the well-meaning advice from friends and family is helpful. And depending upon age, it's appropriate to keep trying for at least 3 to 6 months. However, at some stage, you may wish to seek reassurance that you're not wasting your time. At this stage, you will approach a professional who will take a full medical history and ensure that there are no obvious pointers towards difficulty conceiving, and then arrange to perform some basic tests. Broadly, what you wish to know is the woman ovulating? Is the man producing sperm? And can they get together? Perhaps when the blood test is performed for the ovulation test, then a measure of ovarian reserve is also recommended. It is unlikely, though, at the moment that your GP or local hospital can arrange to perform these tests, and in fact it's difficult for us to do this at care also because of the restrictions on travel and social distancing. However, when these restrictions are lifted, it's possible that the NHS locally will have differing priorities and pressures upon their service, and therefore you may wish to access the private sector. It's also reasonable, if you are thinking of having tests and moving forwards, perhaps even into treatment, then it would be worthwhile addressing this with your local GP, because as I mentioned previously, when the pandemic passes, this may not be a priority for the NHS. Therefore, some advice early on from the private sector may be appropriate, and there's no reason to be concerned that this is an expensive, slippery slope. After all, advice is just that and must be taken into context. If you wish for further information, this can be found on our website, carefertility.com, and in the meantime, good luck and keep everyone safe.